All right, everyone. Thank you for coming to this quarter's bonus, Pilates for Pros. I like to offer this class every May as an ode to National Pilates Day, which is actually tomorrow, but I have a previous engagement. So it's National Pilates Day, if you didn't know that, tomorrow, the first Saturday in May. And yeah, I just like to offer this class to the professionals. I think oftentimes we neglect ourselves in this whole process of trying to take care of our clients and patients. And so I just wanted to make sure that we're giving ourselves that love and support. And if you're not doing it, then I'm here to do it for you. I'm just going to flash up a quick liability waiver just to make sure that we're all on the same page. You're here at your own risk and you're not going to do anything that you don't want to do. And you're making your own clinical judgment on whether or not something's appropriate for you. With that being said, we'll move on. All right, just a quick introduction of who I am and how I got here. So I actually did not start in Pilates. I did not start in Pilates and then head into neuro. I was in the neuro field first, and then I moved into the Pilates. So I worked as an activity-based therapy trainer for about 4 years, starting in 2011. And as maybe you guys are familiar with, these are long days working with neuro clients. It's physically demanding on our bodies with the gait training and the lifting and the supporting and all of that. And maybe like a few of you, I encountered like chronic low back pain at the ripe age of 25. Only 2 years into this career that I really, really loved. And I felt like I was kind of at a crossroads on whether or not I needed to change career paths. Like I felt kind of like actually I felt like that was the only other option, was to completely pivot and change career path. But sort of at the right perfect timing, I found Pilates. In 2014, a few of my clients introduced Pilates to me. I didn't really want anything to do with it per se for myself. Like I kind of clumped Pilates and yoga together. I had tried yoga in the past. It wasn't for me. But I found Pilates, and at first I started applying it with my neuro clients. It was a beautiful, novel stimulus. It focused on foundations in movement, like scapular mechanics and breath control and spine movements. And I found that my clients were really, truly, finally, truly connecting to their body on a different level. It took me about 6 months to actually start doing Pilates for myself. I kind of thought, well, if my clients are doing that, maybe I should probably do it myself. And in 2015, I tried my first mat class, and all of a sudden I had no back pain. Now, correlation, causation, like who knows, but I just felt like this was the miracle drug that I had been looking for that would help me create, some longevity in my career and be able to keep doing the things that I loved and be able to keep serving my clients. So I drank the Kool-Aid. I dove like headfirst all the way in, full on. I quit my job at the ABT clinic. I started my Pilates training in 2015, a month later after my first Pilates class. It took me about a year and a half to become comprehensively certified through the National Certification Program. Within that time, I changed my rehab model from traditional ABT pillars like lots of standing time, repetitive motion through gait training, body weight supported gait training, even like FES and eSTIM. And I really scaled it back to just movement foundations through kind of the lens of a Pilates-based program. And then the other thing that I switched was that I started personally doing Pilates 2 to 3 times a week to support my back and also just be able to, feel better in my body finally. So I went all in. I drank the Kool-Aid for sure. And through that experience of switching to a Pilates-based model and doing Pilates for myself, it enabled me to be still in neuro 15 years later. And I am so proud to say that I've been doing this for 15 years when most neuro clinicians burn out after just a couple years, whether that's physical burnout or even the mental workload. So I continue doing a personal practice plus other things like I do lift and I do cardio and stuff. But the Pilates I really do feel like has helped keep me tuned to be able to do this work. I also feel like the personal practice and the development of my practice, that's why they call it a practice, right? Is that I have an embodiment of integration that I'm able to pass on to my clients. And so I truly understand, or I feel like I have a really good base of movement principles and movement foundations, biomechanics, orthokinematics, what it feels like to move through fascia and leverage your fascia for efficiency and force production. And again, that true body connection. I truly do feel connected to my body and a love for my body, relationship with my body. And what this has given me then from a clinical perspective is being able to teach these things through experience versus memorization. And the discussions are fun because my clients will tell me, oh, I feel this expansive lift, or I feel taller. And I'll be like, yeah, I know exactly what you're talking about, right? It's that shared experience. And then kind of on the other side of that is Pilates just gave me this ability to support my clients in a whole other way, like physically through the use of the equipment. There's this photo here of me working with Theo in the early days. You know, he's like in this crazy inverted quadruped position. If I was doing that with my own body, that's why I was having low back pain. So the equipment really allowed me to support my clients in creative ways and dynamic positions without putting the strain on my own system. And, you know, when my body's freed up physically, my brain is more available to get creative and think through things. So the equipment really gave me that. In addition, the equipment is really amazing for the kinesthetic feedback for my clients with the dynamic spring tension and the kickback from the springs and the bounce from the springs and the resonance that has with the body. My clients are able to feel and react versus me telling them what to do and then having them have to go through that whole like process loop in their output. If you don't already know, the whole deal with free offerings is that there's always going to be some sort of plug for something. So if you didn't already know, I am offering my upcoming workshop series in May. It's the Pilates equipment for neuro rehab applications. We're doing 5 live calls throughout the month of May, and all of the replays are available through the course portal. I'm not going to say too much more about that, but if you're interested in learning more about that, it's all on my website, and I'll send all that information out in the follow-up email. But I do want to say that the pre-sale ends on May 5th, which is the first day of the live calls, and then the price will increase as it's cataloged as a self-paced course. All right. The key takeaway that I have learned from Pilates, you know, all of that stuff that I just mentioned, but the key takeaway that I got from it, if I were to zoom out, is that if we're looking for good outputs from our clients and patients, in other words, if we're looking for a specific performance or function from them, it's not necessarily like how intelligent they are or, you know, how able-bodied they are. Very clearly, I work with spinal cord injury, and probably several of you do as well. It's more about the good inputs. So between the cues that we're giving, whether that's a verbal cue or a tactile cue or some sort of input from our equipment setup, or even the environment, you know, is it cold? Is it too warm? Is the music too loud? Are the lights too harsh? All of these inputs are what creates that desired performance, or what create the undesired performance, right? So making sure that we're thinking about, when we're working with our clients, what kind of inputs are creating the performance that's happening, and, you know, is that desired or not? And what do we need to change about that input to create the desired performance? So that's my biggest takeaway from Pilates. It's been such a great teaching modality for me to be a better clinician for my clients. So for today, tips for class. I want you to, as we're going through this, I want you to pick an angle today. Are you taking this class for you? Just to enjoy it for yourself, treat yourself to a beautiful movement flow, feel good in your body, connect. It's the end of the week, Pilates happy hour. That's an amazing option. Or you can kind of take this class as an experience in the analysis of strategic use of inputs. So between props and verbal cueing to create deeper experiences in movement. So I'm going to be layering in some different verbal cues. We're going to be using the resistance band. So feeling how a line of pull may change an experience. external feedback from the squish ball, and then understanding dynamics of the resistance band to be, is this resistance band resisting me or is it actually supporting me, and getting creative with that dynamic. If you want to throw your intention in the chat, I'd love to see why you're here. What grabbed you to be here today? I love that. Cheryl says both. She's going to treat herself and do some analysis. Julia says she wants to know how she can use it at work. Amazing. These are great home exercise program options. Chrissy says both. All right. Love it. Awesome. Great. Very good. I know sometimes it's nice to turn off your brain, but I also think like as neuroprofessionals, we never really stop thinking, Yeah. We're always like, how could I use this? A blessing and a curse. That's why we're so good at what we do, but also a little bit of a curse. All right. So we're going to go ahead and get started. Make sure that you have your bands all set up. Oh, my heart rate's up a little bit. It's always up a little bit when I start teaching. That's all right. That's all right. Oh, I should also say my neighbor's rooster is going off today. So apologize in advance, or maybe just enjoy it. I don't know. I stopped hearing the farm next door. It's white noise at this point. All right. We're going to start standing. Go ahead and just take a quick little march and let your feet land however they land. Do a couple rolls in the shoulder. Do a quick little scan of how your body's feeling today. How are we landing? What's the vibe? Where's your weight distribution? Maybe a deep breath and a hot exhale to finish that little scan up. And then I always like doing my personal assessment for how my body's moving in a moment is a standing roll down. So basically, we're going to take the arms up towards the ceiling. And I know that I'm cut off a little bit, but that's all right. We're going to shrug the shoulders up towards the ears. And you're going to hollow out your stomach and reach up and over the top of a big imaginary beach ball and come into this, what's called a standing roll down, which is different than a forward fold in yoga. Say hello to your hamstrings. Take a little note of maybe tension in your low back or hamstrings, or maybe there's no tension. Good on you. And then go ahead and bring yourself all the way up to stand, and then bring your arms down by your side. Great. We're going to grab our band now and do that same thing. And hopefully your band is about 3 feet off the ground. And we'll do this a few times. So you may need to step forward and back. Figure out the tension, right? Go ahead and bring your arms up towards the ceiling. And just right off the bat, you may feel that your front line is a little bit more engaged just with that tension pulling you back. So find that hollowing and a little bit of shrug in the shoulders. And we're going to go ahead and keep the arms narrow as you come into your roll down. You might start to feel the band wrap around your back, which is beautiful feedback for your spine articulation and your spine flexion. We're going to come up the same way. Try to keep your arms framed to your ears as you bring yourself up. Restacking, the pelvis drops down and the spine stacks up on top. And let's just bring our arms down for a little bit of shakeout and completeness. We're going to do that 2 more times. Inhale up. Shrug the shoulders up and give yourself a little hollow through your front line, pushing out on your band, reaching out to the other end of the mat, fingertips land, feeling the band wrap around the upper back, and seeing if you can push your spine actively into your band. Round through the spine, pull yourself up, release, arms come down by your side for completeness, little shakeout. Let's go through that one more time. Inhale up, stretch out and over. And again, feeling that tension of the band, encouraging you to reach out a little bit further on your mat versus just in a forward fold. Here we go, band logistics. And then bringing yourself up and then releasing down. Nice. Drop off your band. We're just going to come to this end of your mat, the top end of your mat. Let's go some genie arms here. And we're going to do a cross-legged sit down to the floor. This is a classical transition onto the mat. Beautiful. And then a little bit of playfulness. First, grab your hands behind your thighs and go for a rolling like a ball. Something playful, not super structured, just allowing yourself to roll out and massage the spine. playing with some different breath patterns, making sure you're not holding your breath. Because if you hold your breath with your mouth, it will probably exit from another portal. And one more time, roll on back and let's stay here on the mat. Full disclosure, I have a cheat sheet. Otherwise, I just go on tangents. And I want to make sure we get into everything that I want to get into. We're going to grab the bands on our back for some supine arm pulls. We'll start with our feet flat on the ground and we'll work in some layered challenges. So you can always stop wherever you feel like you need to stop. Starting with the arms up overhead. And at that point, when your hands are vertical towards the ceiling, you should already be in the tension of your bands. From here, we're just going to pull the arms down towards your sides. But instead of pulling the arms to the mat, I want you to think about lengthening your fingertips towards your pinky toes. So it's not necessarily about pulling down. It's also about reaching out. Go ahead and float the arms up in that same trajectory. And you might feel that you're making sort of an arc with your arms versus just pulling straight down. Inhale at the top and then exhale to create the tension. Let's add a little bit of a head lift here. So we're going to curl the head and shoulders up as you pull the arms down. Inhale to return. Exhale to curl yourself up. Now you can choose to be in a neutral pelvis, neutral lumbar spine, or to be in an imprinted low back or a posterior pelvic tilt. Beautiful. We're going to do this one more time. Finish down at the bottom and hold. Bring your right leg into tabletop if you'd like, left leg into tabletop if you'd like, and then release your arms back up toward the ceiling. And we're going to do 3 more arm pulls with the legs in tabletop. Here we go. Legs curl or trunk curls, and then release. Legs can straighten if you'd like. Curl. I'm just going to be layering in. Take what you'd like. Up and curl for your last one and hold. We're going to do what's called 100. We're going to have little pulses of the arms with lots of quick inhale, exhale. Good. Keep pumping through those arms. Don't worry about sinking the breath. Don't worry about that. Just thinking about the arms reaching long, like you're trying to stretch that band further out past your hips versus to the floor. Imprinted or neutral spine, your choice. Legs straight or bent or on the floor. Legs can be reaching out. We're just going to go for 4, 3, 2, and 1. Beautiful. Release in. Go ahead and drop your straps. Grab your squish ball for a moment. We're going to come back to those straps in a second. Grab your squish ball, and we're going to place that underneath your sacrum for what I call 3D pelvis, because now our pelvis has all these dimensions to move in. Your arms are just going to be down by your side, easy peasy. And we're going to bring one leg in tabletop and then the other leg in tabletop. All right. Depending on where you place the ball, you may have facilitated either a posterior pelvic tilt or an anterior pelvic tilt. So find something that feels comfortable for you to sort of rest on and you're not too far one way or the other. Okay. Let your feet go lazy and do a couple leg drops, like tapping your toe to the mat. And then try to feel the difference between sort of this floppy foot position and then a nice strong dorsiflex, almost like a closed chain position there. And notice the difference in either your stability or your effort, your efficiency, your core activation, anything of that sort. Beautiful. If you're feeling spice and you want to keep adding on, we're going to bring one or both hands to the ceiling. And again, if you go super straight with your fingers, like opening up your hands really wide and creating energy out through your fingertips, through your armpits, you may feel a little bit more support there. Good. So if you're feeling a little wobbly, that's all okay. That's okay. We're going to go ahead and drop the knees down. Now let's try that same dead bug 3D pelvis maneuver, but let's bring the arms with our straps again. So grabbing those straps the same way you did last time, and then bring the legs into tabletop with the dorsiflex foot. Yes. Go ahead and keep a little bit of tension on that band. And notice that when you encourage some connection through the scapulas, that you're just so much more engaged through the abdominals, like reflexively, right? That's the power of your fascial lines. Right now, you all are feeling your spiral line. And that's so beautiful for our neuro clients, right? Where, we can't let them get too heady. We have to just give them inputs that allow them to reflexively engage whatever we're looking to have them engage, right? Super powerful. Last two, my quads are on fire and release. Awesome. Go ahead and just wring your spine out with a little bit of wiggle on your hips. And then we're going to take that ball out and sit on up. We're going to spin around so that we're facing our band. You're still going to need your squish ball. And we're going to sit in a long sitting position. Now, if you're like me and you have chronically tight hamstrings, like I don't know. I need some help there for sure. No, I mean, if I'm diligent enough and I do the right things, it's all good. But I like just throwing a little squish ball in my pelvis to help me prop a bit more there. And I like the squishiness of the ball because it allows me to oh yeah, I have to work for it, but it's giving me just this little boost. So that's really beautiful. We're going to grab your bands and we're just going to have your arms out in front. And we're going to do what's called chest expansion. So right here, it's called chest expansion, but basically you're just going to pull your arms down by your side, widen your collarbones. Think about scraping your knuckles on the floor and then bringing the arms forward nice and slow. Okay. Now, same thing as before. Of course, I want you to bring your arms behind. I want you to pull on the bands, but I want you to think more about pushing down and getting taller and having that reflex of lift through the spine, through that vertical pull, the vertical axis, and then release. Don't forget your importance of the wrist alignment there. Don't let your wrists get lazy. It's all part of the line. Good. Pull, release, pull. 2 more. And last one. Beautiful. And release. Now keep in mind, I'm just giving you guys little teasers of things. So double back to anything that you feel like you want more of. All right, we're going to take that squish ball out for now. And we're going to take the band and we're going to wrap it around our back and bring it to the sides. Now, as you're already doing that, I can tell you guys are you're neuro pros at heart, right? You're oh my gosh, this is actually really cool. Look at that. So we have now the dynamic support of the band to help with that postural lift. So even someone with maybe loosey-goosey shoulders or not as quite connected in the shoulder girdle, we can still give them that postural lift that we felt from before. Let's go with a little bit of a roll back here. So you're going to start to roll yourself down towards the mat. And then as far as you'd like to go, maybe it's all the way, maybe it's not, you're going to pull yourself back into your seated position. Beautiful. We're using that band as feedback. So as you start to roll back, instead of just Frankenstein leaning back, right? We're going to actively push our spine into the band and roll through. And then again, on the way up, actively press down on that band to create a deeper trunk curl. Yeah, a couple more here. Beautiful. Reaching back. And curl. Good. Such a deeper work through the abdominals. Last 2. You got it. And one more time, please. Nice. And release. All right, we're going to take the band out from behind us. We're going to be working on the other end of your mat for what's called swan lift. If you, I think you're going to need to fold up your mat. So fold up your mat in half or just completely cast it off to the side, depending. You're also going to need your sliders. And, make sure that you're still in line with your band because we are going to grab that. So you're still going to be in front of your band, but we're going to be stomach down, facing out this way. All right. So you have your sliders or your towels, and we're going to have them out in front of us. Beautiful. So we're going to do something called swan lift. And as you're coming into your position here on your stomach, let's go into the extreme of letting our forehead rest on the floor and shrugging your shoulders up towards the other end of the room, which similar to what we did with our standing roll downs, where we kind of like shrug the shoulder up and create this hollowing in the front line. And whenever I do flexion extension, I really enjoy stretching into the extreme of one, which highlights then the recoil of going into the other. So moving into then full body extension. So as we press out, you're going to shrug the shoulders up and hollow the belly, get your front line on. And then as you come out of that, you shrug the shoulders down, press a little bit in through the pinky sides of your hand to find your extension. Now, I'm not looking for like super big height here. I'm not looking for crazy extension in the lumbar spine. I'm mostly looking for a little bit of thoracic extension, but it's distributed through the entire back line. So you might feel like glutes or hamstrings, maybe even like the back of your neck is working really hard to keep that alignment. Let's do that 2 more times. Just that little scapular glide, which connects us into our back line. Beautiful. Now, let's feel what the straps give us. If we did a little bit of strap work, and in Pilates, this is called breaststroke, or a version of breaststroke. Before we go into breaststroke, let's just feel what that band is now doing. We can already feel that's giving us some input back. But again, I like the reach, the stretch. So more input to feel, oh yeah, now I really have to stretch and through front line activation. And then almost controlling the band, because it's almost like doing it for you. Oh my gosh. And then you could actually get into a bit more extension if you really wanted to. Beautiful, nice. Now in Pilates, if you're doing this on the reformer, you can play with this in terms of doing your swan lift with a red spring versus a yellow spring, because they will give you different experiences. Good. Let's go into a little bit of a breaststroke here. Sweep the arms around. They'll come into your body and then punch through. We have to work around the band just a little bit. Good. And I always like to say when I'm doing prone kind of work with my clients, I like to say you're snorkeling, right? Look down at the reef. Don't let your head hang, but don't cock your head up. You're snorkeling. You don't need to worry about bringing your head above the water. You're amazed at the water, what's underneath you. And we're swimming. Just keep swimming, just keep swimming. And I just love that feedback of the band. Maybe 2 more. And last one. Beautiful. And release. Little sit back into child's pose. You can stretch out your low back if you need to, undo the straps. And I just had this thought. I recently have felt that I may have, I don't know, hypermobility in some of my joints, which someone pointed out to me. She's like, yeah, you kind of are klutzy. And I'm realizing, yeah, my proprioception, I don't think is great. And I think that's why I do love the feedback of the band so much, because it gives me this like end range feel for my body, like where my limbs are, which I don't think is, I think a lot of our patients and our clients experience that as well. So, loss of sensation and proprioception is very common in neuroclients, and, we can identify with that. All right. We're going to come down into a little bit of side body work. So coming into a Z sit, if that feels okay for you. So we can either be in a Z sit or 90-90. If that feels a little too extreme, you can be in a side sit. If that even still feels too extreme, you can certainly be in a cross-legged position. We are going to, we're also going to need our sliders. I think my sliders will work okay on this mat here, but if you need to fold up your mat, please do that. All right. So we're going to have one band in each hand, and you're going to place that the outside hand on the slider that's closest to your hip. You also have another slider that's kind of off of your knee. All right. And then we've got this hand by our ear. Yes. All right. So we're going to do a mermaid side bend here, where we're going to press out on the low arm and stretch up and over with that top arm, and then recoil and bring it back in. And again, I love that feedback of the control on the return. Inhale, up and over, big stretch, especially through this top arm, so much feedback there. And then bring it back in. Oh, my armpit is cramping. Love it. Love it. Reach, inhale, and exposing those ribs to the ceiling. Inhale like an accordion, and then exhale to recoil. This time we're gonna grab onto that other slider with your free hand. So we're gonna go inhale, open first, find your side body. Exhale, wrap and rotate. You're gonna grab on. Now we're gonna take some oomph here. Push your inside hand out, but your outside hand in, and look over your shoulder. So you should be like fully twisted pretzel. Good. Bring your front hand forward and your other hand back. And now you're in your side body. Twist to get into your rotation. Oh yeah, I should have kept my mat folded. Sorry. Return. We'll fix it on the other side. And return. And I like to inhale on the opening and then exhale, wring everything out on the twist. You got it. One more time. Exhale. You got it. From here, we're going to take outside hand out. Before you undo, stretch out. Reach up, rainbow arc, and then pull yourself all the way home. Awesome. Beautiful. We got to do the other side, yeah? Let's spin around to the other side. I'm going to stay facing you. It'll be me that's lopsided, not you, all right? We're going to set ourselves up to switch around to the other side. If you want to fold up your mat, you can. Let's do that. Just so we have a really nice surface to glide on. Sit closer or further away, depending on the band tension preferences. And here we go. We have one hand. Oh, come on, Steph. Come on, band. One hand on the inside hip and then one side on the knee. Here we go. We're going to go for that first one first. We stretch out and over. Inhale. Oh, so good. And then bring it back. I do not mind doing this one over again on this side. Inhale, open. Good thing this is my shorter side. Bring it back. You got it. Getting tall first and then getting that lateral bend and return. All right, let's add that twist. Here we go. We go up and over first. Inhale. Grab on. Push out. Exhale with the twist. Whoa. Reaching through the bands. Bring ourselves back in for inhale to side body. Exhale for twist. Inhale for side body. Nice. Exhale for twist. Inhale for side body. We'll do that one more time. Press out and stay there. Take a little extra. Come into side body. And remember, when we undo, you push out first, sweep, and come through. Nice. So good. All right. Sliders off to the side. We're going to do some side lying leg work or side lying hip work, some abduction work. And I need to make sure that my bands are even. They keep shuffling through. Sometimes you can knot them and then that's fine. All right. So here's what we're going to do. We're going to be laying on the side that's facing me. If you want to face me first, the bands are going to go under on the bottom foot, actually. So the bottom foot, and then we're going to lie on our side. And you're like, but Steph, that's not abduction, that's adduction. All right. The band on that bottom foot is to cue and make sure that you're keeping that foot planted. So yes, it is abduction into the floor, which is super important if we're going to float the top leg. We need a strong base of support underneath for us to generate movement and power on the other side. Body half organization, one side stability, one side movement power here. So lots of work to push the bottom foot down. Top leg is lifting and lowering. Now, this is not Jane Fonda world. We're in Pilates land, which means we're going to lift up a waistline underneath, keeping the trunk in neutral alignment and really stable so that the movement that's coming from the top leg is actual true abduction and we're not borrowing range of motion from our waist. All right. So I like to put my hand on my hip because again, proprioception challenges for me. I like to put my hand on my hip and traction my hip long with my hand, which keeps my waistline long on this side and lifted on the bottom. We're going to go for 2 more there. And last one. Good. Before we switch sides, now let's do kind of your Pilates version of bringing your foot So the band's on the top leg. Cool. Depending on the tightness of your band and where you have it anchored, you may feel an effect now on the abduction. There we go, Steph. It's Friday. A deduction of the leg pulling in. Yep. Or maybe you're feeling it sort of like Goldilocks zone. It's not hard to lift up and it's not hard to lift down. Now, luckily, we have this line of compression going kind of towards the ladder or towards your anchor point. So instead of thinking of it as an abduction or a deduction exercise, you can think of it as a stretch and length through the leg, again, to keep that waistline open, right? And then go through your up and down motion. So you're always pressing out on the band. You're trying to make that top leg longer, lifting up and down. And hopefully you have some of this residual connection from the prior setup of pushing that bottom foot into the floor. So we gave you that kinesthetic cue of how important it is to push down, which is then going to give you a different experience with the leg lift here. Okay. Let's do 2 more. We're going to keep it simple. There's lots of choreography that you do here, circles, Peter Pans, all that kind of stuff. We're going to keep it simple. Last one, and then release. Before we go to the other side, I would like you to stand up and just notice how your body feels in the weight distribution. There's no right or wrong answer. I don't have an expectation for what you're going to feel. I just want you to feel. Do you feel more comfortable with your weight shift in one leg versus the other? Is that different than when you started? Is it different than what your default is? And then let's go ahead and do the same thing on the other side. So you'll either roll away from me or change your camera position. Again, we're going to start with the band on the bottom foot. Band on the bottom foot. And again, that bottom foot is now being cued to press into the floor, right? Press into the floor. Love it. Let's go ahead and start with the top leg lift. Bottom foot is, of course, being cued to push into the floor and maybe even a little bit of length, right? I like using my top hand as well as that tactile cue for length and traction for my waistline, keeping my lifted waistline on this side, neutral, low back and core, strong core, so that I'm really truly working hip abduction and not borrowing from my lumbar spine. You can also play with a pointed foot versus the dorsiflex foot. How does that change your experience? That one, the jury's out. I haven't decided. I ask everyone and, it still feels like a 50-50, like, oh, I like it pointed. Oh, I like it flexed. But you won't know until you try. Beautiful. Let's go 2 more. Smoky hips. Last one. And then release. Let's go ahead and switch to the top foot. I say smoky hips and I'm like, yeah, it's been so smoky in bed these last couple of days. So luckily it's clear right now. Got the garage door open. All right, we got the top leg going. We still have this now experience of like, oh yeah, I got to ground my bottom foot. Hopefully that feels a little bit more reflexive with that experience. And then we're going to go for that lift and lower here. Again, it may feel like you're pulling down. It may still feel like you have to work to lift the leg. It may feel sort of like somewhere in between and you're kind of floating. The idea with the band is to give you the cue of pushing out long, keeping the waistline long there. Yes, good. You got it. Making sure that your hips are stacked. You're not rolling open to, again, borrow range of motion, maybe from your hip flexors. Let's go 3 more, 2 more, and last one, and release. All right, taking off that band, let's do a standing check-in real quick. Just see how your body's now feeling, right versus left. Is there a difference in your perception of where your weight shift is? Same, better, different, worse? Not sure. All a practice. Every time you ask yourself to assess, you're bringing that attention into your body. All right, we're going to go with some kneeling work with our straps. We're going to start with kneeling cervitre and some arm circles. So we'll be on facing our anchor point. Now, you can do this exercise. I like doing it in a tall kneel position. You can do it in a low kneel. You can do it in a split kneel. You can do it in seated. You can do it sitting on a box. We will be doing it standing in a little bit. Yeah. If you tend to have a wide base in your kneel position, sometimes I'll even have my clients grab a squish ball and just bring them a little bit more to midline. Oh, I'm sorry, we're doing serve a tray. Haha, someone call me out. We're going to face away from the anchor point. Yes. All right. So serve a tray right here. We're going to start with the elbows bent and the palms facing up. The motion is like, hey, do you want an hors d'oeuvre? Okay, I'm going to bring it back in and walk around to the next person. But the intention is we roll the shoulders, and that reaching forward is not so chesty, but it's coming from your armpits and reaching out, right? It's sort of this like drop and float, kind of an uppercut motion, if you know that motion. And what I like about the bands is that the bands, it gives you sort of this like hug and cue to wrap your armpit kind of in that band. All right. So walk forward or crawl forward or back if you need a little bit of change there. Nice. Let's do some arm circles. This one, you're going to fight the band a little bit. Just work with it. You're going to go up. You may separate your hands a little bit. Bring the arms around. Now, of course, we felt this earlier. As the arms come up overhead, we get more vulnerable in our front line. So keeping that eccentric control, that front line, that hollow out, arms are going to come out into a T. Beautiful stretch for the chest. And then we recoil and bring the elbows underneath you. Exhale to reach away. Let those shoulders drop. As the arms come up, flare the armpits even further. Further. The more you can protract and upward rotate those scapulas, the more hollowing and spiral line and front line you're going to get. All right, exhale, press. Lift. Around, we got 2 more. And last one. Very good. And with that ball in between your thighs, that extra cue from midline, getting that pelvis to tuck under, beautiful. We're going to spin around to face the front now. Face your straps for chest expansion. And right here, you can scoot back. You're probably going to be strong in this one. So either scooting back or choking up on your straps. And this is similar to what we did earlier. We're just going to do a few here with pulling the arms straight behind you. Again, work your wrists. Make sure your wrists are strong. Collarbones are open. And it's not so much about pulling the bands back. I'm not looking for super range of motion. I'm looking for that downward pressure and armpit slide without too much rib flare, right? Return. 2 more. And last one. Now, for some of us, this may feel not too bad of an exercise, right? For our clients, especially our paras, like our paraplegic, like low, like T levels, L levels, that even seated chest expansion is super, super hard because of the lack of the lower body integration. So just to get a little feel of what that feels like for us, our version of what that might feel like is if you come to a stand and let's decrease our base of support dramatically, coming up into a high heel and go for your chest expansion there. Notice how much more tippy that is for you to be able to do that. That's a little bit more of the sensation that our clients might get that aren't integrating through the lower half, are not able to because of paralysis, or are limited in that integration, in an acute setting. If you'd like to make it even a little bit more, you can kind of float and pull simultaneously and then release the heels down as you release the tension in the band. So getting that like super dynamic in the moment control. Nice. Let's go 2 more. And last one. Good. And then release. Now, we just played with those movements in the front plane and the back plane, but of course, you can play with that in the lateral plane as well. I'm going to skip that one, and we're going to move on to a little bit of thigh stretch coming down onto our knees. You will want your ball again this time. Again, getting that midline connection so it's not so it keeps you in that front line. Maybe I need to explain that a little bit. When you squeeze your thighs together, that helps you connect into your deep line, which is your adductors, your pelvic floor, your deep abdominal muscles. and your diaphragm. All right. So a little entry point, a little access portal to your core is that thigh squeeze. Thigh stretch, also known as a reverse Nordic. Choke up on your straps. All of you are like, oh God, oh God, oh God. Yep. So we're going to squeeze the ball and we're going to go for a lean back, hinging at the knee and then bringing yourself vertical. Now, if you turned off your front line, it would turn into a back bend and then coming back up. In Pilates, at least, we're going to keep a little bit of that front line activation. So yes, squeeze the ball, a little bit of a pelvic tilt, shoulders are on, find your serratus, find your front line, and push down a little bit in that band. That's going to help you keep that front line hollowing as you're going into severe extension, right? Here we go. 2 more of the thigh stretch. Enjoy it. Smile through the pain and then bring yourself back up. You got it. Re-engage the squeeze. My forehead veins are popping. That means something. And then bring it all the way up. Very nice. And release. Now, if we wanted to support that in another way, we could probably come forward a little bit. We could bring the band around our torso again. Question, little critical thinking. If we put it behind our back, that may cue someone to hinge there, correct? So you can either have the sort of extensor support through your glutes. Sometimes I also like putting it more at the upper back, which creates a little bit of that like flexion, the spine flexion to keep the front line on. So let's play with both of those. Maybe just 1 or 2 with the thorax supported and 1 or 2 with the hip supported. Now, in full transparency, I would normally use heavier bands. So if you're feeling like this is really hard, you are correct. It's all good. I would use a heavier band. Okay. All right. Just wanted to show you a few of those options. Love it. All right. Next 2 exercises, we're almost finished. We're just going to take the band off and we're going to free float it. And we're going to do what's called a serape band. I learned that from a yogi and I didn't fact check it. So I don't know. It's called a serape band. We're going to bring it onto our backs. And your band's going to be kind of across your back, maybe just above your bra line. And then you're holding onto the ends. And if that feels too heavy, you can certainly you don't have to double it up. You can just do a single and like wrap the straps. All right. So you're going to roll onto your back. Let's just do a simple bridge without the cue of the band. Go ahead and press the hips up and lower the hips down. No articulation, just a stability bridge up and down. Okay. For clients that have a little less front line, in my experience, I ask them to bridge. They drive their hands into the mat, arch their back, and passively float their ribs. And so essentially they're using back extension solely to get the hip extension. Okay. Beautiful. We can check that box. They performed, but not in the way that I wanted them to in terms of like connectedness and integration. So in order to keep the front line on, I'm actually going to take their arms a little bit away from them and cue them in that serratus with the arms above. Now, if you do a little bit of a tail tuck and then press the hips up and pressing your back, cueing to press your back into the band, there's no way you can go back extension for hip extension. So much more isolated in the hips, in the glutes, stretching through the hip flexors, stretching in the quads. Yes? Beautiful. Nice. 2 more. And last one. And then release. Bend your knees in, rock and roll. Can you do a fancy transition into hands and knees? Cross the legs over, roll through the shins, and come onto your all fours. We're going to keep the band in our hands. And again, if it gets too heavy, then you can loosen it up. You can loosen it up. You have free will. Actually, we're gonna put the band in the lumbar spine for this one. All right. So the band's in the lumbar spine. And right now that band is cueing beautiful lumbar extension, wide sits bones, tail is lifted, anterior pelvic tilt, open chest. Beautiful. If we were to do a cat cow here, I'm going to challenge us instead of doing just like coming from the center. What if we started by pressing into the band first? So, like, round through the tail, push into the band in that lower half of the spine, and then let that wave into the flexion. And then let's go, let the band go first. So, we're going to go tails lifted, the band drops down, wave through the spine, widen through the collarbones, and bringing your eyes and head up last. All right. So, pressing into the band first, and then waving out from there in both directions. Now, depending on who you are, who's in front of you, you can put that band wherever you want them to focus their attention. So if you want thoracic flexion, throw it up a little higher. If you want super like low lumbar, yeah, throw it wherever you want that flexion to happen. Or wherever you want the extension to happen too, right? Because it goes in both directions. Again, I love that cue of the extremes of like, hey, here's the strut. That's probably my proprioception thing again. Here's the extreme to then go into the opposite direction. And release. Yeah, last one. Excellent. Nice job. Go ahead and sit back, shake out your wrist. Awesome. Beautiful. Little time check. Perfect. All right, come on up to a stand, y'all. We're gonna finish with the same roll down that we started with. I'm gonna let you choose. Do you want to do it with the band or without? I'm gonna do it without the band because I want to feel like an actual, like, unsupported, uncued roll down. How did it change? So go ahead and march a few times just to find your foot placement that feels like a natural land. Arms up toward the ceiling, little shrug up. Maybe you're feeling all those armpit abs that we did earlier, reaching out to the other end. Oh my gosh, so much more space in my spine right off the bat. Fingertips land. My hamstrings still tight, but they're a little happier. Taking some notes for yourself, go ahead and bring yourself all the way up to stand again, stacking the pelvis on top of your femurs and then your spine on top of the pelvis. And let's just do it 2 more times. The roll downs, they feel so good. And lift. You got it. And one more time, lifting up, reaching out and over. And pull. And return, arms down by your side. If it feels right for you to close your eyes, go ahead and do that and go for your body scan here. Post class, what's the vibe? What's the weight shift? Oftentimes after a healthy bout of movement and body connectedness, we have what's called postural sway, which is where we have this subtle oscillation within the quadrants and the sides of our body, front, back, side to side quadrants. And that postural sway is indicative of really healthy tissues being able to absorb forces and then redistribute them, as opposed to them coming into our body being stagnant and then staying there. The postural sway is so beautiful. It allows us to move and distribute our forces. Let's take one deep breath in. Inhale at the top and exhale down. Excellent job, you guys. Thank you so much for joining me. I just have a little bit extra last slide or two to share. Well, there's the class. I would love to hear what your favorite exercise was, or a moment that you had, or how the band helped deepen your practice. I would love to hear any feedback that you have. So throwing that in the chat. Oh, great for cueing the cat cow. Yeah, I know, right? Loved all the appropriate feedback with the band, especially the cat cow and the hip bridge. Oh, I'm glad I added that. That was like a little tidbit at the end. Beautiful. Hip bridge with the serratus touch. Oh my gosh, that's awesome, Cheryl. Yeah, with the tight hip flexors. Yeah. Prone slider reach. I know, with the feedback in the shoulders, doesn't let someone overextend. That's my issue. I kind of overextend. So good. Thank you for that feedback. I really appreciate that. I'm like, oh, this feels good in my body. Do other people like it? All right, just a quick last moment. As I know that Pilates and Pilates equipment is rising in its appearance in clinics, and I absolutely love this for the rehab world because you're seizing the support that the equipment can offer you. Taking that load off your body, like I experienced. So I'm so happy to see this happening. At the same time, I get nervous for client safety and negative experiences due to lack of training and clinics and clinicians not getting their ROI on these pieces of equipment. And so I just, as a public service announcement, I just say, if you get equipment, whether that's Pilates equipment or any equipment, really, right? We need to be doing our due diligence and getting trained. And if that's something that you're interested, again, I have the online workshop series coming up. And it's live calls and self-paced. It's actually basically I used to do, or I have done, in services for PT clinics and ABT clinics where I taught non-Pilates instructors how to use their Pilates equipment and leverage that for their neuro clients. And I basically took that and put it into an online format. So I'm so excited to be able to offer that in May. It's something I've been wanting to do for a long time. And other than that, that's all I got for you today, y'all. Thank you so much for coming. I'm going to turn off the recording. If you have any other comments or you just want to stick around and say hi, we can do that. All right. Thanks.